Let's talk about authoritarianism. It's a word that gets thrown around a lot, often to describe a gym teacher who was a little too enthusiastic about dodgeball. But real authoritarianism isn't about getting pelted in the face with a red rubber ball. It's about a government that grabs power, holds it with an iron fist, and tells its citizens, "Your rights? Oh, those were just a suggestion." Think of it as a political system where the user agreement has only one clause. The government can and will do whatever it wants, and you, the citizen, have approximately zero say in the matter. There are no checks, no balances, just a straight line of command from the top to everyone else. This isn't some abstract political science theory. It's a reality for billions of people. Authoritarian regimes are masters of control. They control the media, so the only news you get is the news they approve. They control the courts, so justice is whatever the leader had for breakfast. They control the economy, which sounds efficient until you realize they're running it like a personal piggy bank for them and their friends. And while we often focus on the brave young protesters in the streets, we tend to forget who is most vulnerable when a society rots from the head down: the elderly. They are the silent, forgotten victims of these power-hungry systems. Why them? Because a lifetime of work, saving, and contributing to a society means absolutely nothing when that society's rules are rewritten overnight by a dictator with a god complex. And authoritarianism is like a termite infestation for those systems, quietly eating away at the foundations until the entire structure collapses, often with the most vulnerable still inside. They've played by the rules their whole lives, only to have the game board flipped over in their final years by a group of people who see them not as revered elders, but as a budgetary line item to be cut. It's a quiet crisis, unfolding in the shadows of grand political dramas, and it's a profound betrayal of the social contract. Because if a nation can't protect those who built it, what is it even for? All right, let's talk about pensions. For most people, a pension is the finish line. It's the pot of gold at the end of a 40-year rainbow of mind-numbing meetings and pretending to like your boss's jokes. You work, you contribute, and you trust that when you're done, there will be a system in place to support you. It is, in essence, a promise. But under an authoritarian regime, that promise is worth about as much as a lifetime subscription to a newspaper that's been shut down by the state, which is to say, nothing. Authoritarian leaders see national pension funds less as a sacred trust and more as an unguarded ATM with a very high withdrawal limit. The first move in the authoritarian playbook is often economic mismanagement, which inevitably leads to hyperinflation. Look at Argentina, a country that has flirted with authoritarian policies and economic chaos for decades. In periods of extreme inflation, pensions that were once enough to live on become little more than pocket money. A 2023 report showed the minimum state pension covered barely a quarter of a senior's basic food basket. Imagine spending your entire life saving for a comfortable retirement, only to find your life savings can now barely buy you a week's worth of groceries. Now for a topic that's fun for the whole family: healthcare, or more accurately, the spectacular implosion of it under authoritarian rule. A functioning healthcare system is one of the pillars of a decent society. It's the safety net that catches you when you get sick. But in an authoritarian state, that net is often full of holes, or it's been sold for scrap to pay for a new palace. For senior citizens, who are statistically more likely to need medical care, this isn't an inconvenience, it's a death sentence. When a regime prioritizes military parades over medicine, propaganda over prescriptions, it's the elderly who pay the price first. They pay it with their lives. Consider the quality of care. Authoritarian governments thrive on secrecy and control, the exact opposite of what you need for a good healthcare system. Doctors and nurses work in fear, unable to speak out about shortages of medicine, broken equipment, disastrous public health policies. During the initial COVID-19 outbreak in China, doctors like Li Wenliang, who tried to warn the public, were silenced. This culture of fear means problems are never fixed. They're hidden. For a senior with a chronic condition like diabetes or heart disease, this means a constant, terrifying uncertainty. Is the medicine at the pharmacy genuine? Will the hospital have the equipment they need for surgery? The answer is often a resounding maybe. Then there's the issue of access. In many authoritarian countries, healthcare becomes a two-tiered nightmare. One system for the party elite and their families, gleaming modern hospitals, the best doctors, imported medicines. Another system for everyone else, crumbling underfunded clinics, long lines, exhausted staff, empty pharmacy shelves. For an elderly person, getting sick becomes a terrifying lottery with odds stacked against them. When the state fails you, where do you turn? For most people, the answer is family. Family is the ultimate safety net. But modern authoritarianism doesn't just attack public institutions, it attacks private ones, right down to the family unit. One powerful way authoritarianism fractures families is through forced migration. When the state is run into the ground by corruption and oppression, the young and able often leave. They seek safety elsewhere. They seek freedom elsewhere. They seek economic opportunity elsewhere. That creates a brain drain and a devastating care drain. Venezuela is a horrifyingly perfect example. Over 7.7 million Venezuelans have fled since 2015. Millions of sons and daughters can no longer care for aging parents. If you want to see a living, breathing nightmare of what authoritarianism does to the elderly, you don't need a textbook. You just need to look at Venezuela. What was once one of South America's richest nations has been systematically dismantled by an authoritarian regime, resulting in a humanitarian crisis that has been particularly cruel to its senior citizens. Let's start with the money, or the complete lack of it. Thanks to years of catastrophic economic mismanagement under the Chavista regime, Venezuela has experienced one of the worst cases of hyperinflation in modern history. As of early 2024, the monthly state pension was equivalent to about $3.60. That is not a typo. An organization called Convite AC found that this amount covers less than 1% of the basic monthly food basket for one person. Seniors who spent their lives working and contributing to the Social Security system now receive a pension that can't even buy them a carton of eggs. They are left to scavenge, beg, or starve. Then there's the healthcare system, which has effectively ceased to exist for the average person. A 2021 National Hospital Survey revealed that 70% of hospitals experienced failures in their water supply, and 66% had regular power outages. How do you perform surgery in the dark? How do you keep medicine refrigerated with no power? The answer is, you don't. For seniors, many of whom suffer from chronic illnesses like hypertension or diabetes, this is a death sentence. A study found that 88% of elderly Venezuelans surveyed could not regularly access the medicines they needed. They are dying from treatable conditions, simply because their government has prioritized its own power over their lives. And finally, the family, the last refuge, has been shattered. As mentioned, millions have fled Venezuela, leaving an estimated 1.2 million children and countless elderly parents behind. This mass exodus has created a generation of white-haired orphans, seniors left to fend for themselves without the support of their children. They are not only deprived of financial help, but also the physical care and emotional care that is crucial in old age. Venezuela is more than a case study. It's a terrifying warning. It shows how quickly a nation's promise to its elders can be broken, and how completely they can be discarded by a regime that sees them as nothing more than a burden. You might think that the digital age with its promise of connection would be a blessing for isolated seniors, and in a free society, it often is. But in the hands of a modern authoritarian regime, technology is not a window to the world. It's a wall of a prison cell. These governments have become terrifyingly adept at using digital tools not to empower citizens, but to control, monitor, isolate. For senior citizens, who are often less tech-savvy, this creates a new and insidious layer of oppression, trapping them in a digital cage they may not even understand. In China, the government has built the world's most sophisticated surveillance state. Facial recognition, social credit systems, extensive online monitoring. For a senior citizen, this means that any expression of dissent can have serious consequences, even in a private chat with a family member. The fear of being watched stifles free expression and deepens their isolation. Imagine being afraid to tell your own child what you really think because the app you're using is monitored by the state. Furthermore, access to essential services is increasingly being tied to government-controlled digital platforms. Receiving your pension, booking a doctor's appointment, buying groceries. This is the digital divide on steroids. For seniors who may not own a smartphone or who struggle to navigate complex apps, this creates an insurmountable barrier. It effectively locks them out of society. A 2022 report highlighted how China's health code system during the pandemic left many elderly citizens unable to enter public spaces or use public transport. They become prisoners in their own homes, not by law, but by technology. Finally, these digital tools are perfect for spreading propaganda and misinformation, which directly targets and manipulates the elderly. Authoritarian regimes can flood state-controlled media and social platforms with narratives that glorify the leader, demonize dissent, create a false sense of stability. Seniors, who may rely more heavily on traditional or state-run media for their news, are particularly vulnerable to this manipulation. This information control deepens their isolation from reality, making it harder for them to understand the true state of their country and why they are suffering. The digital world, instead of being a tool for liberation, becomes the regime's most powerful instrument for manufacturing consent and ensuring obedience, even from its most forgotten citizens. So, after all that, where does this leave us? It leaves us with a deeply uncomfortable truth. In the shadow of every strongman, behind every patriotic parade, there is a generation of elderly citizens being quietly and systematically erased. Their savings are stolen to fund the ambitions of the state. Their health is sacrificed at the altar of political control. Their families, their last and most vital support system, are fractured by fear and forced migration. This is not a series of unfortunate accidents. It is the predictable, calculated outcome of a political system that values power above all else, especially above human dignity. The suffering of seniors under authoritarianism should serve as the ultimate canary in the coal mine for the rest of us. It is a direct measure of a government's cruelty and a society's moral decay. When a nation begins to treat the people who built it as disposable, it is a sign that the fundamental contract between the state and the citizen has been broken beyond repair. It reveals a regime that has no long-term vision beyond its own survival, a regime that consumes its own past to fuel its present. The plight of the elderly is not a niche issue. It is the clearest possible indictment of the entire system. We cannot afford to look away. We cannot dismiss these stories as distant problems happening to other people. The rise of authoritarian tendencies is a global phenomenon. Control, neglect, the sacrifice of the vulnerable. Ignoring the plight of seniors in Venezuela, Russia, China is not just a failure of empathy. It's a failure to recognize the warning signs for our own societies. The systems that are supposed to protect us, pensions, healthcare, the rule of law, are fragile. The moment we allow them to be compromised for anyone, they become compromised for everyone. Ultimately, a nation's greatness is not measured by the size of its army or the height of its skyscrapers. It is measured by its compassion. It is measured by how it cares for its most vulnerable, its children, its sick, and its elderly. If you think this can't happen in the United States, just take a look around.